Hi there. I'm Angela Esposito, and I'm so happy that I have the opportunity to still speak to you today. I'm practically reporting from inside of an igloo because of this blizzard, and unfortunately, I wasn't able to exhibit in person, so I've set up a very pathetic display behind me in my home office. So thank you for giving me that opportunity to talk. Let's get into it. So excited to talk about why I am glad that I was made redundant, how I've been rebuilding a life science career with AI as a consultant and founder of Chronic Consultancy. I didn't always feel super glad when this first happened. For 15 years, I was climbing the marketing ladder and really had a different vision for myself. So let's get down to the sticky situation. When this happens, unfortunately, if this happens to anyone, you're left with one core question. What do I do now? There's a million others that come with the territory, but this was the first gut punch because for so many years, as you're climbing up the ladder in marketing, you can wear a lot of titles. Maybe you start off as an intern, lucky if you get paid. Then you get a little bit better at your craft and you might get hired as a specialist. You move yourself up to a manager role. You climb even higher to become a deputy director or even a director. You work your way up and become VP of marketing. Years go by and you are the president of your marketing department. And if you're so lucky and you truly have it all, they see your worth and you go up to CEO. That's a lot of titles to wear in a lifetime. So, what happens when someone kicks the ladder out right from under you? None of this makes sense anymore. And you're left with feeling one core question inside: what do I do now? And with that question, you need to figure out what you truly want because the one card that will never stop being attached to you is this one: feeling capable, because that's what you are. Going through something as life changing as a redundancy can give you clarity if you choose to let it give you clarity. It can give you the opportunity to start asking stronger questions, like what kind of life do I want to build now? I'm so used to working remote, seeing all of these jobs pop up where I'm going to have to travel and miss out on key times that I could be spending with my family or being afraid of what that work environment might look like, or not even having the opportunity to interview for those roles can be a little soul destroying if you are thinking about doing something different. So that's when a plethora of questions came after I went through my panic period, which was briefer than I expected. I started shifting my questioning and lines of reasoning towards possibility. Who do I want to work with? What if you can choose to work with really nice people? Ones that really care about patient outcomes or the patients themselves. Do I want to optimize slides or outcomes? Um, I this is no dig to any corporate company, but I never thought PowerPoint would be the number one application most healthcare marketers have to use in order to succeed. And after many years of doing it, I want to figure out if there's a way to optimize my skill set. Like I said before, working remote is very appealing to me. I know that the first few years of your child's life are quintessential. And if you have that ability to connect with your children early, it's going to do a world of good and you won't miss out on those big opportunities. That's where the questions around how can I spend more time with her, with my 2-year-olds, really started to infiltrate my lines of thinking. Um, This one, I know we all go through it, and it is hard until it's not. But do I really need to go through another brutal interview cycle? Um, it's not to say that the interviews are brutal themselves, but the feeling of not even getting the interview to then having those opportunities seem really fantastic, but then the job description doesn't own up to the actual role at hand. They can leave you with a lot of anxiety and a lot of thought process that makes you forget about what you're capable of. So then I started to take all of these questions and I put the panic aside to a key sticky note that I'm wearing currently. Should I just master what's coming up next, AI and the rest, and finally build my own company instead of chasing what's considered safe? I've been interviewing for certain roles, and it's funny, but the head count gets lost before they even award the role to someone, so no one gets the job. And then there's the scenario of what if you become redundant again at the next company? Or what is that next boss going to be like? And are they really caring about what the company's ethos really is? So that's why I started going and doing some soul searching. And I often do that through podcasts. Podcasts keep us up to date and fresh and inspired. And there was a lot of them on entrepreneurship that I was really interested in listening to. And on one of the podcasts that I listened to recently, they spoke about this concept of these four zones that occur in Gay Hendricks' book, The Big Leap. I highly recommend it. It's like a couple bucks on your Kindle if you're looking for probably the most positive book I have ever read, particularly when I'm going through this period of panic to possibility. Um, and I encourage you all, if you have a pen and paper, or in your free time, to start writing down where you fit into these zones. So within these four zones, you have a incompetence zone, which doesn't mean that you're necessarily terrible at these things, but it's clear that other people might be stronger at them than you are. A zone of competence is maybe other people can do these things just as well as you can. And I'll give you some examples of where I fit in this kind of grid afterwards. But what are some things that you do that might feel mundane, but you're good at it, and it's fine, and it's better than having to outsource it to somebody else. Then you work your way up to the zone of excellence, and that's probably where most of you are. You probably find that you are spending so much time doing activities that you're really good at, but it's not quite your calling. And what your calling is that next level, is that zone of genius. And the genius zone is one that if you are lucky enough to experience that, you will be able to unlock a level of potential that you never thought you could and be really happy while you're doing it. And that doesn't just mean by having the most successful business or barely working or traveling the world. It's a concept that will allow you to hone in on something that only you can do um, in a way that's going to make you successful across the whole board. So when I put pen to paper, I don't have to go line by line for all of these things, but incompetence, I'm going to use an accountant. And I encourage you to, unless you have a knack for it or it's in your zone of competence or above. But I am going to make sure that I leave product innovation and engineering to the correct department. And I'm not going to be able to pronounce every single new pharma drug or medical term on the first try. But as I move up into my competence zone, I have added those PowerPoint presentations in there that we love so much, as well as other skills where, hey, I'm definitely competent. I can do the task. I can get paid to do it. Um, but it might not be where I'm most invigorated. And I put AI for marketing on here because I don't know many people that go above the zone of excellence. I am very, very involved with what I do with AI, but I've got so much room to grow, and I'm sure a lot of you in this room also do as well. Then we move up to excellence, where omni-channel marketing and creating strong seed content is something I'm really passionate about. I love doing cross-functional leadership. I love working with all different types of people and collaborating. I love working with different KOLs and patient panels and conducting research and figuring out what to do with that research. That's all exciting. And I know I could be really happy in this zone. But my genius, if we're talking from a context of healthcare marketing, is influencer marketing and storytelling. And I don't mean storytelling in the sense of me speaking to you right now. I mean having the amazing opportunity of telling stories about patients who've actually sat in those waiting rooms, who've gone through the depths of hell to make it to where they are today, that are ready to share their story and see how, even if it's just a fraction of their life, has been improved since using your product. Um, the same thing goes for clinicians and healthcare professionals that do life-changing surgeries, and one wrong move could mean life or death for someone. And it's very harrowing to be able to connect with these people that we truly depend on and need. So once you can kind of identify where you fit in these zones, you can figure out what to do with that free time, if we have any, to really invest in ourselves and our right pathway. Now, I know there's a lot of text on this screen currently, but this is just a quick snapshot of what my Just a Tuesday tech stack looks like when using AI. There's tons of tools out there, but now that I'm full-time consulting, I like to stay budget friendly. So for the cost of no more than like 50 bucks a month, I use ChatGPT Pro at kind of the epicenter of everything that I do. I have these other tools that I like to use for different occasions. So Fathom, for example, now that I don't have Copilot powered by a company and all of the AI genius that comes with writing notes and things like that, you can use tools for free like Fathom, that can hop on as your AI assistant on across Teams and Zoom and Google Meet. Canva, I use Canva all day, every day. I'm sure anyone that does any type of design work also is very up to speed with what Canva's doing. But more and more AI functionalities are being brought in when it comes to copywriting and even AI integration apps. It's not quite there yet, but I think this is the one to watch. So I definitely recommend using this tool if you're doing any type of content creation. Claude is fantastic if you're trying to get your messaging right. So with Claude, think about refining your tone, seeing nuance in what you're doing when you're trying to talk to patients, and using a stronger like skill set of messaging, almost as if you're having your own copywriter, without replacing one, of course. Perplexity is fantastic when you might not be super up to speed with a new client you take on. Maybe you're embarking into a new sector, and you know that you're capable, going back to that card. But Perplexity will help you determine how to create content based on what is really topical at the moment. It's very research based. It's basically like your research co-pilot. It's a fantastic content strategy engine, and it's great for listening at forums, and it's a good way to do your research before you get going with a project. And Gemini, through Google, is actually what powers everything in the back end when you're creating Google ads, whether it's Performance Max ads or if you're trying to do, keyword planning. Gemini is actually the powerhouse behind all of that. So I had to mention it here because you're using it without even knowing. And with this, um, ChatGPT Pro, I use for just about everything. I love that I know it's like 20 bucks a month, but if you pay for it, you can actually upload images or slides or emails that make no sense from like 50 people in an email thread. You can put those together to try to figure out what would be a cohesive way to create this sales aid, with everyone's input, and be really intentional with that, or to help you see through, I don't know, a bunch of clinical resources that probably would have taken you days to go through, you can do within a couple of hours now. So it's an amazing platform. I'm sure you all use some type of variation of it. Creating custom GPTs are quintessential for really knowing the audience per client. So I love using it. I use it in my day to day. It helps me determine what to eat and um, when's the best time to book a flight and all the rest. So um, it's definitely one that has to be included into my list. But then I also have a wish list, which there's a number of them, some of which I actually learned about while attending the last AI conference and the last reputation conference here. So it's a great opportunity to learn different things when you are at these conferences because um, I have been blown away by some of the projects that I've seen other people use when using Midjourney, for example, to make high impact visual concepts and campaign imagery beyond just traditional like stock content. Um, Apollo is great if you're trying to generate leads. So as like basically a freelance consultant, if I want to try to find the right types of clients, it's good to tap into Apollo because it uses AI-driven prospecting and intent data to help me find high quality contacts. Descript is super cool. This one is great for podcast editing. So that's that's where I also want to upskill myself and become a podcaster or at least be able to do that for clients. So that way we have the opportunity to sit across the table, even if it's virtually, to connect with fantastic kind of KOLs and patients and people high up in their roles in healthcare marketing too. I think it's really important, and it's great seed content. Sanithya, which I'm probably saying wrong. This looks great if you're wanting to generate AI video. However, tread lightly. I do feel like, you can't really replace real human interactions, but it'd be great if you're trying to make a bulk amount of educational content. So this is great for training up your sales teams, or if you are trying to have educational pieces, as long as you disclaim that it's AI generated. We're going to see more and more of that as time goes on. Then Taplio is a cool one that I've seen recently that I've added to my wish list. It's an AI powered LinkedIn intelligence kind of way for you to be on top of your either personal branding or your company on LinkedIn to help grow influence in that space. And with most of us needing to do a lot of B2B marketing, it's really cool. If you've ever used the plugin Grammarly before, that kind of feeds into all of your posts and everything that you do. It's kind of like that where it'll even help you generate what types of comments would be valuable when you're trying to um, be super active on other people's account. To feed the algorithm, basically, you need to participate on LinkedIn. So that one's really cool. Um, N8N. This one I've just been exposed to recently. This helps you build like intelligent, artificial intelligent automations that connect your tools and turn inbound signals into a structured pipeline. So this is really cool. So let's say you're doing a LinkedIn Navigator campaign and you want to be able to allow it to read positive sentiments. So if someone's interested and wants to learn more, you can mark them and qualify them as a lead. So that's really cool. And then Market Beam, which is actually who someone that exhibited previously, I got to connect with someone that works there. And this is definitely on the wish list because it's a fantastic way for us to amplify our brand messaging and stick to compliant healthcare marketing. Highly encourage you to check them out too. And SEMrush, which is not just AI, but it does have really strong AI components when you're trying to do more extensive keyword research, when you're doing SEO, GEO now, and any kind of AdWords planning. So if you want to go above and beyond what Gemini provides, Google, and you've got 150 bucks a month to spend or whatever it is, great. I would definitely recommend it. It's a powerful system. But at the end of the day, the biggest blind spot when it comes to using AI is you, right? So there is a really high chance that AI will get it wrong for you time and time again. If you don't have the right people in place to not just fact check, but also make it feel human and relatable, you're healthcare campaigns aren't going to hit quite the same. So I know where I sit when it comes to mapping out my zones of excellence and genius, competence, and definitely so many on the incompetence side that I would love us to have the opportunity to connect and whether you're looking to freelance or you're part of a marketing agency that has a specialty or you're just looking for support, I want to build a effectively like a talent network. So as new opportunities arise and I need help and support, I'd love to get you involved. I know a lot of us love to have our side hustles or consult full time. Some of the speakers here definitely work for themselves, and that's fantastic too. So if you're interested, it's free. It's not a salesy thing. It's just an opportunity for us to connect. I wish we could have done this in person. I have 250 postcards about it. And maybe I'll use it at the next event. I also want to start quarterly um, virtual networking events where we can kind of knowledge share what's happening. We're in such a niche form of healthcare marketing that I feel like it would make sense for us to have that bit of touch base that is fine if there's a snowstorm around the corner. So if you're interested, please scan that QR code and fill out the form and we'll connect. And yeah, so thank you so much for giving me the opportunity to speak. And I look forward to seeing you in person next time. Okay, bye.